Welcome to the season 2 of the In Your Shoes podcast. The podcast aims to get into the shoes of a person like you and me and learn from their career stories and experiences. Through this conversation, we will uncover insights and pearls of wisdom which will hopefully inspire you and expand your thinking. We're doing something different this season. Apart from a full length show, we will also expand on topics of interest that emerge during the conversation. These will be distributed as special episodes, which are short, targeted, and provide you with the context when you are short on time. Let us get right into it. Welcome to the podcast, Dana.
Thank you so much, Vivek. Thank you for inviting me, and I'm looking forward to a wonderful conversation.
For our podcast listeners, Dana, could you kindly share a little bit about yourself, like where you come from and what you do for a living?
Yes, thank you so much for asking that. I moved to the United States 17 years ago, coming from Eastern Europe, from Romania. And at that young age, I had already had a vision that I was not going to be able to pursue my life in the way that I wanted it due to the political context and socioeconomic context at that time in Eastern Europe. So I came to the United States and I started my training as a physician in internal medicine, and I was very quickly drawn towards palliative care, and I'm gonna tell you exactly how that happened. In my usual rotations as a physician on a medical surgical floor at a cancer center in New York, at a pretty famous cancer center in New York City, I realized that there was a big missing piece in the way the treatment plans were being put together, or the people were treated in general. And that piece had to do with the element of listening, the element of taking the time to create a human connection from the beginning, and treating people as a whole. So I realized that at that time that the only field of medicine that was integrating a holistic approach in taking care of people was palliative care. So I became very curious and very engaged in learning about the model, and I was accepted in a palliative care fellowship at Memorial Sloan Kettering Cancer Center, and since then I have been dedicating my career to this field.
Wow. I picked up few things which I really wanted to go detail into. Like, for example, you mentioned about finding this holistic meaning and treating people as a whole. I really resonate with that. Tell me a little bit about this element of listening which you picked up while you were making your shifts as a physician in the initial part of your career, which led to perhaps you feeling interested about palliative care.
Yeah, it's something that it's so profoundly simple, right? But unfortunately, because the way the system is designed in our modern world these days, basically robs physicians and other clinicians in general of the opportunity to dedicate this time to listen to their patients in a in a very genuine way. So let me give you an example. I think it's people who are specifically for this field that palliative medicine, as you mentioned earlier, is a very holistic model and treats people. It basically offers an extra layer of support for those who are going through either an active treatment for a serial illness, or they live with a chronic condition that is not curable, or what I do right now in hospice, we are caring for those who are in the end stages of their lives. So this element of listening is, I would say, from my experience, has the most has the highest therapeutic value. In the sense that someone who's suffering, and I think I actually read that somewhere recently in one of it might have been Brené Brown, who basically articulated this very eloquently. She said, the soul that is suffering doesn't need to be advised, fixed, or saved. It simply needs to be witnessed. So when you learn and practice that skill of witnessing someone suffering, it completely changes the dynamic of the relationship, and like I said, in itself has a tremendous therapeutic value. In addition to the technical aspects of care, of course, you still have to have the skills to, manage someone's symptoms and keep them comfortable from a physical level. But if you are missing the opportunity to make that connection and become a portal to witness their process without trying to fix anything, and simply holding the space for the healing to happen, I think that's where the magic is.
I think this is very profound, what you just said. Witnessing the suffering instead of trying to fix it. I want to take a few steps back. You mentioned that the current system perhaps, robs the opportunity for physicians to dedicate this time to listening. What do you think is causing this, or why do you think the system is like this, the way it is?
Yeah, it's unfortunate because there has been a shift in strategies and practices and so on, and the modern healthcare systems, and it doesn't apply only for the United States. It's basically the same model. You encounter the same model in Europe and in other parts of the world. It has become highly profit driven, and the focus is on saving money, recycling resources, making the systems efficient and so on. It's great. I mean, you have to have a business practice that is sustainable at a financial level. However, in that process, the human-centered and care got pushed to the side. And it's only now, I have to say, which I'm I'm secretly grateful for this, because the COVID-19 pandemic has brought back more. It has pushed us basically to return to a deeper understanding and to explore deeper ways of integrating this human-centered care back into our practices. So I'm not sure exactly if it's a kind of temporary shift, or it's going to become solidified and integrated back. But I feel like the model started with the human at the center of care, and then it got derailed by the business, right? It got derailed by the fact that, yes, we have so many private insurance companies, and everybody's trying to make money, but also pretend that they're saving money for the government-based agencies, and so on and so forth. So it's a very, I would call it a very, it's like dirty dancing, because you have to be able to navigate those territories. And this is what I want to go back to, the way I made this choice intentionally. I opted out of a model of care that is focused on profit. And I intentionally choose to remove myself from that dynamic of bureaucracy and profit-driven practices and so on, that tends to be more connected to hospital systems in general. And I chose to practice in the home care setting. So we care for our people in their own homes, in their own intimate environments. We get to know them as they are in their real world, with their pets, with their families, with their mess, with their art, with the everything goes. We have this philosophy that all is one. So you can just choose to see the beautiful aspects of someone's being and ignore the ugly. You have to, in order to be able to understand someone, you have to see everything. So I think working in directly with these people in their own homes gives us a phenomenal opportunity to understand this in the bigger picture, to have a bigger picture view of who they are.
Wow, I really liked how you mentioned that. Um, Going forward, as you were talking about the aspect of witnessing the suffering without trying to fix it, how was your initial experience getting into this? Like when you decided that uh, the palliative care is where you want to be, how was your experience getting into this? What were your first observations when you got into this line of work?
Yeah, I have to say that obviously my style of practice has evolved throughout the years. And at the beginning, so I just want to clarify that the palliative care model is uh, has been the foundational model of interdisciplinary care, right? So you can do this type of work on your own. It's not a one-man show, and you have only one person who has the skills or the ability to address the multidimensionality of suffering, right? So we work. Our team is made of a nurse, a social worker, a spiritual care counselor, a grief and bereavement counselor, physical therapist, volunteers who play a tremendous role in offering support to those who are part of the program, and physician, of course, and so on. So everybody brings to the table their own skill set. And at the very beginning, when I started doing this, I was not very good at wearing multiple hats. So the beautiful aspect of this is that as you start working in a model like that, and you have a team that is basically, whose skills are intertwining, and that's a very fluid environment. So basically, you learn from each other all the time. It allows you to grow, right, and expand your own area of expertise. So at the very beginning, when I started, I was rigidly wearing my physician's hat, yeah, and I would go in into the homes. And most of the time I like to do a lot of visits jointly with other discipline, for instance, a nurse or a social worker, because I wanted to stimulate that mutual learning environment, right? So at the very beginning, I was very much focused on, oh, there's something that I need to fix. There's something that there's something there was this very heavy perception of responsibility. Like I felt like, because I'm a doctor, I have to go in and I always have to find a solution, right? And try to fix something. And it was very much, very medical driven. Oh, these are the symptoms and so on. So I was missing out on the additional layers of, I mean, not completely, but it was not my focus, right? I was not basically, I didn't have the ability to expand my own field of perception at that time, to see everything, right? Like the shamans. The shamans are people who have this amazing skill of seeing everything. Yeah. So in time, because of this constant practice, and working with people who, like I said, brought in different perspectives and taught me a lot about, how to navigate these territories, I evolved into a much how should I call it? It's a rounder and a more spacious. The approach right now is more spacious in the sense that I am able to see things that I was not able to see before. Things that have to do with, the non-physical elements of suffering. We're very much focused on pain management in our practice, because pain is one of the main quality of life altering symptoms. That's how we call them. So understanding that someone's pain, we integrate a model of total pain that is basically made of the physical element, and then the psychosocial and the spiritual, emotional, and so on. So we want to be able to capture all these nuances, so that when we offer an intervention, basically it addresses all these elements, as it's not focused only on the physicality, right? So this is to bring it to return to your question, is I was mainly focused on the physical elements of suffering at the very beginning of my career, and now my approach is much more expansive and broad.
Hmm. And Dana, what led to this transition, like from your initial focus on being a physician and having that hat and trying to fix the problem, to something more like what you are right now, is having this multiple hats and being a holistic person in yourself addressing this. So could you share through, or perhaps throw more light on perhaps events and experiences that led to this transition?
It's a phenomenal question, Vivek, because I realized that, I mean, it's basically the result of my own inner work. And I started taking the first steps on what I called the seeker's path, um, putting intentional effort into. Don't get me wrong; it's not an effort that is painful. It's basically an effort that has to do with consistency of certain practices, and some element of discipline around that. But the change has been driven by the work that I have been doing on myself, my inner work, and the fact that having the exposure to this type of work, basically I started seeing it as a phenomenal opportunity and invitation to recalibrate my own existence and to reflect on my own mortality, to think about what are the things that really matter in a human's life. How am I staying connected to things that bring me meaning at a personal level, and how can I take that meaning and put it in some sort of an expression that translates in an action that serves others. I don't know if that makes sense, but it was basically, and it's it's a constant. It's this kind of work that we're talking about, the inner work of self-reflection, self-knowledge, basically getting to know who you are, and constantly remaining curious about that, and staying current with the changes, because we're constantly evolving. We are at a material and spiritual level. We are in constant change and evolution. So that has become my new foundation to that allowed me to change my perspective, and I am so grateful, because I feel that if I was not practicing in this world, in this field, of palliative care, I would have probably missed that opportunity to do this inner work, to start doing this inner work at the time when I have been, when I took the first steps on the seeker's path. So when I talk about the seeker's path, is basically, understand, if you understand the multidimensionality of your own being, and this constant force of energy that is causing this changes, and what is it that is driving your own evolution, you show up into the world with a different how should I call that? It's not just a different attitude. It's a different view. You see the world. Most of the time, I don't know if you're familiar with Ram Dass, one of the our contemporary spiritual teachers, who used to say, most people operate on channel 1. And it's the channel 1 is the channel where everybody subscribes to the standardized models that the society imposes on us, our families, and so on and so forth. And you basically you are, for most of your life, on autopilot, trying to please or others, or to conform to certain rules about life and society and so on, that have been designed by others, definitely not you. And in time, when you get to that moment where you start questioning that, right? You said, well, I'm really not, I don't feel like I fit into this model, and what is it that I can do to get curious and expand my world, and be able to rise above, basically, right? It's you transcend to a different level. And again, I'm not talking about practices that are mystical or whatnot. I'm talking about this curiosity that comes from within, to push you at a different channel. So you get to channel 2, and when you're at channel 2, you're like, wow, I have a different view of my life right now. not only that I have a different view, but I also have a different understanding of how all the other humans around me live and connect and it's basically kind of a bird's view, right? It's just as you get a little higher, uh, it's kind of a, from a semantics point, it's very interesting because there is a kind of a paradoxical relationship there. Some spiritual practitioners or teachers talk about lifting up, right, transcending to a higher level of consciousness, whereas others talk about you have to go deep within to go down. So you know what I'm saying? It's a paradox between, actually, in order to lift higher, you have to go deeper within yourself to rise up. I don't know if that makes sense.
It
You know what I'm
does. It
saying?
does. I think it also opens up a lot of questions for me. And I think one of the meta questions that pops to my head already is, being a physician, being in medicine, and also a person of science, how do you, let me ask, like, I think first is how and what led to your introduction to spirituality? Was this like since the beginning, or you, when you went to the, or when you went to the process of, being in the palliative care, that opened up your perspective to spirituality? So if you could just give us a view on how do you blend that, and how did it really happen? Like, is it a occurrence that kind of had to happen because you were in this line of work, or this was something that you already saw yourself, like this is part of you?
Fantastic question, because I come from a culture where there was zero exposure to spirituality. So I grew up in a, during the communist regime in Romania, and at that time, if I could say that, everything was 100% anti-spirituality. So, and also within my own family, there was really no exposure to any spiritual practices or and so on. So definitely, I felt that now when I'm thinking about my upbringing and so on, I feel like there was a handicap, that I didn't have that opportunity to start exploring my spiritual dimension sooner, earlier in my life. Um, and yes, I feel like the triggers have come from um, witnessing that at the bedside. So I started when I started seeing people dying. We had an inpatient hospice unit where we had 25 beds, and when people could no longer stay at home, or there were um, complicated situations and families chose not to have their loved ones die at home, we had an actual place where people could go and die. And I was working there. I had been working there for a few months, and I finally, like, when you witness death firsthand and people die in front of you, right? There is always this question about what happens. Like, what happens with the spirit? What happens with their soul? What happens when you see someone taking their last breath, and then the body goes, immobile, and there is no further pulse, and so on and so forth. And there is in those moments where you just start wondering about all these other dimensions, and that's when, by witnessing this deaths, people dying in front of me, I started I started getting, I mean, it's not that I was not exposed to that concept before, but I became more interested in the spiritual dimension of dying. And now I basically put a lot of emphasis in, with the teams that I work with on this element. And I always want to make sure that people are not missing that, that we are a medical practice, but dying in itself is 100% a spiritual act.
Right. I think what I hear from you is the deliberate choice of for yourself to move to palliative care was like a transformative journey for yourself, right?
It is still a transformative journey. It is. It's every single day. This is why I am so humbled. Everybody, when I tend to talk to people who are not very familiar with what that really means and what we really do for our patients, and everybody has this tendency to ask something like, oh, or say something like, oh, that must be so depressing. Oh, you're working with people at the end of their lives who are dying. That must be so depressing. And I go, not at all. First of all, there's nothing depressing about dying because it's only an part of the natural cycle of life. We all come from, the original creative source, and then we return to the same place. So this culture that has conditioned us into thinking that we are never going to die, it's basically has completely is misleading people into thinking that dying is some sort of unnatural process or some sort of undeserved punishment and so on. So you know what I'm saying? People have become so disconnected from their own embedded mortality, right? We all are born to die, and we are so distracted by our modern culture that's trying to convince us that no, there's something wrong about dying, that you have to do everything you can to push it away or deny it or stigmatize it or whatever it is. So because of that, it's becoming this uh, idea that when you're caring for those who are dying, it must be uh, a profoundly unpleasant experience, right? Associated with sadness, with a lot of negative emotions and so on. The way I see it, like I said, it's I see it as a constant opportunity to learn from people's stories and experiences, and it's a constant opportunity to do this self recalibration, and we're basically, all of us, not just those who work in the palliative care field, all of us are always standing in the face of death. Imagine that. It's like from the day you are born, death is always by your side. It's always there. Because you choose not to acknowledge that, it doesn't mean that death is not there with you. It accompanies you every step of the way, you know. But we somehow became, brainwashed and into thinking that no, you don't really have to think about that you just have to focus on your day-to-day needs and live your life as if you are immortal, not doing any reflective work at all, not focusing on the elements of what really gives your life meaning. What is the reason you are brought into this life, right? And try to connect with that, so that when you take actions and you move ahead, you have a kind of a deeper understanding of what is it that you're doing with your life in general. You know what I'm saying? Instead of robotically following the steps that the system has already laid out in front of you.
Right. So the meta topic that I kind of take away from here is be deliberate on how you're living your life. So you're mindful that you're not living a life assuming you're going to be there forever,
Yep.
and accept mortality as just natural thing. It's not a negative thing. It's just how it's a part of life.
Yeah, I mean, but just if you simply look at the reality, right? Mortality rate is still holding steadily at 100%.
Yeah.
Right? Do you know? Do you know anyone who made it out alive? You know what I'm saying?
Yeah.
This is what we're saying. Like, I don't know anybody who made it out of this life alive.
Yeah.
We're all heading in the same direction.
Yeah.
So this is the reality. But like I said, we're getting derailed and kind of misled into this fantasy and delusion that oh no, it's not important. And it's also one of the most beautiful. People are, as you get older and wiser, you know, you start realizing how important it is, because this is another element that I wanted to really talk about. That another element of what we do in our practices, you know, inspiring people to plan for the end of their life, right? So to remove that element of surprise. Oh my God, now I'm dying. How am I going to get ready for that? You know what I'm saying? Instead of being surprised by the fact that you're dying, it's better to start planning the same way you're planning to have a new child, the same way you're planning to get married, the same plan, you know, the same way. It's as important to plan for the end of your life as it is to plan for any other major events in your life.
Right. That's very profound, and I totally see your point. It completely makes sense. I
It,
Go ahead.
you know, I just wanted to say that the Buddhists have this
Mm-hmm.
very beautiful ritual, and they create throughout their lives, right? So it's not a last minute thing. They don't do it in the last week of their life, and so they are creating this mini legacy throughout the course of their lives, and it's called a Dharma Box. And you know, they capture the miniatures of pieces of their lives that they consider they're the most relevant, and also they very they plan in detail the way they, you know, the way the way they want their body to be handled after the death, what kind of music they want to have to play at their funeral, what kind of memorial service they want to have. So it's basically, you know, an intentional act of saying, you know, this is my end, this is the last chapter of my book, right? I want to make sure that I it 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 is handled the way I see it, the way I want it to be. This is the way I want to live this, you know, this embodiment that I have right now, instead of leaving that on someone else's shoulder to figure out what you would have liked, what kind of, you know. So it makes things, number one, simpler for those who are, you know, left behind, but also I have to say it has an extra benefit in the sense that it tends to diminish a little bit the element of grief, because those who are left responsible to make these arrangements and so on and so forth, they actually feel a huge relief when they say, hey, I actually know what my loved one wanted, you know, and I am here to honor that. I'm here to honor their legacy. I'm here to make sure that the dignity is being honored as well. So it's a very, in itself, it has a very positive effect on the grieving process.
I really like that part. Dana, what is your day? I would say, if you have a typical day in your work, looks like.
Um, it's it depends. It depends on the day. I'm very grateful that I have a lot of flexibility and I can design my own, schedule. I tend to, through the work that I do with the teams that I work with, I identify people who tend to have the highest needs, right? So there are complex situations where there are very intense family dynamics and symptom management needs, and the complexity tends to be high, right? And somebody in the team usually stratifies those things, and we all get together virtually these days, and talk about our patients, and I have developed, my own inner system to know exactly intuitively. I have to say also, this kind of work is greatly based on intuition. Like, you need to know when to do certain things. You need to know when to step back. You need to know when to give people time, So there are situations where, somebody on my team says, "Oh, I think you should go and see this patient." And I say, I think we should give them a few more days, to allow them to settle in. These transitions, this is a topic for a different conversation, but transitions of care right now between different settings, right, from the hospital to the home, sometimes happen very ungracefully, and there is an element of trauma, I would say, attached to that, right? So you have to be, timing is the key. You have to be really good at knowing when is the right time to to go in. So as a doctor, like I said, there is still this perception among not only clinicians in my team but also families and so on, that the doctor is perceived as the having the highest authority, right? And if the doctor is going in to visit somebody, well, it means that it's a big day. I mean, it really is. So my intention really is to remove that. I don't go in with blows and whistles and blah blah blah. It's really not about it at all. I go in very humbly, and I do my best, like I said, to create that to create a space for that direct human connection to happen. And yeah, so I do visits, not every day. When I do not do in-person visits these days, we are using telehealth as a new tool to be able to engage with patients, and for me to be able to be present in some of these homes when someone else on my team is there and facility needs me for a consultation and so on. So that has been really helpful lately. When I don't do that, I'm in constant collaboration with everyone who's in the field. When we say in the field in people's homes. So I also am working right now on developing an oncology hospice specialty program within our organization. So it's a hybrid role between clinical and academic, and program development and strategy and quality things that have to do with our regulatory requirements and so on. And so that's the work piece. But I have a very beautiful practice of self-care, and I think that's probably would, if you want to talk about that, I think that is my lifeline.
Can you say a little bit more about what do you mean by self-care here?
Yeah, so it really this idea connects back to what we were talking about before, of how how you evolve as a person, right? In by doing this work. It wasn't just this shift from, integrating, having a broader understanding of suffering in general, but also how important it is to care for yourself, to be able to care for others. It's the key thing for our practice in general, but I would say it's a key thing for any human. If you are, let's say, if you are a caregiver for, if you're one of your parents is sick at home, or your spouse or a child, or it doesn't have to be a terminal illness. A caregiving is a very broad term, right? The simple philosophy is that in order to be able to care for others, you have to care for yourself. So this is basically one of the pillars for us in palliative care. We all learn how to do self-care. So my self-care practice, if I can share that with you, consists of I have a meditation practice in the morning. I also have a self-inquiry practice where I write 20 minutes a day in the morning using prompts. I work with a teacher online who teaches this. It's a spiritual practice, basically using writing, self-inquiry practices in understanding yourself step by step and layer by layer, speaking only the truth about your experiences, your past, your present, and so on. So it's called a self-inquiry practice. So I have that, and I also have a movement practice. I move my body to be able to move the energy and allow the a kind of an internal recalibration of energetic flows and so on. Either it's a combination of movement practice, either yoga or strength, or there is a beautiful thing that I came across a few months ago. It's been, I think, since July. It's called the 5 Tibetan rites. It's a mini yoga practice that was created by Tibetan monks as a tool to increase their longevity.
Can you repeat that?
It's called
Yeah.
5 Tibetan rites.
Rights. Okay.
RITES.
Oh wow. Okay.
So it's basically a mini Tibetan yoga flow, right? Like if you talk about vinyasa flow in the more traditional Indian, vinyasa flow is one of the yoga practices, but this is a Tibetan yoga that is heavily based on coordination between breath and movement. But what it does, it allows energy to flow through 5 different vortexes of energy that we have naturally in our bodies to unlock the areas where the energy gets stuck. And the concept of that is, the Tibetan still feel very strongly that illness in general is caused by blockage of these energetic channels. So these monks, created this practice hundreds of years ago, and it's something that I have integrated in my movement practice recently, and I absolutely love it. I'm gonna probably leave.
Very interesting. No, I think
I don't know,
we could spend
25
hours
years
talking
more.
about this itself.
Yeah, 25 years or something. I mean, they get, you talk about, when we're talking about data driven, um, results, they showed that they expanded their lifespan by 25 years or more. So, but again, it's not so much about longevity. It's about, this is another thing that I wanted to make sure that is clear about the model of palliative care. It's about the quality of your life. right? So I don't care if I live to 105. I'm really focused on what kind of quality those, extra 25 years are going to have. How I can maintain that same level of quality by keeping my body healthy, my mind healthy, and moving along, accepting the changes that are normally going to happen, right, in our physical bodies and our mental capacities and cognitive abilities and so on, but being more more versatile, I would say, um, in in um, in preserving that element of quality. Right? I don't want to be 105 in a wheelchair and completely demented and with a feeding tube. That's not my definition of quality of life.
Hmm. So, Jana, imagine there is someone listening to this podcast and they really are curious about palliative care, and they just see themselves being in this line of work. What would be your advice for them, like in terms of what experiences you would like them to have? Where should they start?
Where should I start? Oh wow. We tend to say that people are called towards certain things in life, and I don't necessarily agree with that, right? I mean, there are so many opportunities we come across, and if you don't pay attention to the opportunities that are there in front of you, you may not take them, as they present themselves to you. So particularly for the area of palliative care and end of life care, I feel, however, that there is a certain quality of people that are drawn towards that. For anyone who would be interested or curious in learning more about the model, or even becoming practitioners, I would say you simply have to follow your heart. You have to follow that inner intuition, that inner voice that tells you why you would want to do that. For me, it has been basically, like I said, uh, a very organic, intuitive process. You know what I'm saying? I didn't sit down to go through tables or checklists or, things to say, hey, I'm going to do surgery versus dermatology versus, palliative care. It wasn't like that at all. It was more of a kind of a natural, like an energy that was pulling me towards that. And it had to do with the fact that myself, as a human, I feel most connected with this element of uh, deep human interactions. Like understanding human suffering at a deeper level. And I think this is the only field that allows for that right now in the current design of our healthcare system. Yeah, I'm not sure if that answers your questions, but I would just say again, it's more about um, having that almost like a it's not a like a force that is driving, is pulling you towards a field like this. And it's also um, you have to be someone who is very compassionate and empathic. You can it's impossible to work like this is not it's a very different model than what a surgeon does or an anesthesiologist does, right? I'm not saying that they cannot integrate ways to connect with the people that the patients that they treat at a human level, but it's a very different quality of the interaction. right? So that's why I would say it's basically, if that's your focus as a human being, and you really want to, your mission is to genuinely and authentically serve others and be of service, this is an area where you would be thriving.
Fantastic. I cannot end this conversation without asking you, Dana, about your recommendation, especially books or anything that you would like to recommend our audience.
Oh yeah, okay. Well, thank you for asking that, because I'm so, three recent books that I have read, and one of I two of them, and one it's I'm reading it right now. So we talked about meaning, right, and finding meaning, and how you stay connected, and that, it's sometimes people have this um, perception of this overwhelming task that we have as humans to find meaning in our lives. Right? And it's if you look at it like that, it's basically, it sets you up for failure, because you're constantly searching for something that is bigger than you. You don't know how to connect with it, and so on. But anyway, to keep things simple, Viktor Frankl's Yes to Life in Spite of Everything. Yes to Life in Spite of Everything is actually came out this year. It's the first time it was published, and it's a collection of um, some of the lectures that he gave in different academic settings back in Vienna when he came out of the concentration camps. As you know, Viktor Frankl is the founder of meaning center therapy. In my training, I worked a lot with psychologists who were actually implementing a meaning dignity center therapy in the cancer center where I trained. So I have been exposed to his teachings and philosophy a while ago. But this book, like I said, is brand new, and it's a very concise blueprint for how to go about finding meaning in your life. So that's one. Should I go on? Okay. All right. The next one, the author, it's the author of this book. It's called Sex, Death, Enlightenment, and it's written by the teacher who with whom I have been doing my self-inquiry practice. His name is Mark Matusek, and it's basically I couldn't put it down. I have to say it's a memoir, and it talks about his life, and how he, exactly the same question you asked me, how he came to the realization that there is a need to rise above by going deeper, right? And it's a very beautifully written a book that I highly recommend. And the book that I think, honestly, it has the highest potential to change people's lives. And I'm so grateful that someone on the platform that we met, by the way, recommended it to me. It's called Anti-Fragile by Nassim Nicholas Taleb. Anti-Fragile: Things That Gain from Disorder. And it's fascinating. I mean, I just started reading it a few days ago, and I am in awe about not only the content, it's just the ideas that he expressed in this book, and I'm so excited to continue reading it. But by the way, this is one of the books that leaders in the Israeli army recommend to the new soldiers to as a mandatory reading. I don't know if that tells you anything, but it's a very
No, I've been a fan of Mr. Taleb. I think I have read Anti-Fragile some time back. It's still on my book and on the list at the top of the books, I would say.
So you read it? Okay, well, I'm behind you in that. Yeah.
Yeah, I read it, and I think the principles around going beyond resilience and becoming better in the case of adversity and issues. I think that's phenomenal way of thinking about it, and it has a lot of lessons. Like, he takes from the human body, how it reacts.
And this is why I find it so relevant to what I do.
Mm,
Right, because it's exactly what we're talking about. We started talking about, resilience, as he describes this in the book. He says resilience is, yes, you're resisting and you're making it out of a, serious event and so on, but it doesn't change you. Resilience is, you stay the same, whereas anti-fragility, being anti-fragile, you come out of that change. And this is exactly, I think it's a phenomenal way to finish this conversation, is that basically basically this is where I am. It's every single encounter that I have with someone who's dying is basically transforming me at a very deep level, at a molecular level, I would say, and it allows me to, to not to be resilient. And I'm telling, I mean, I'm also, I'm so aware, of course, that I am just another human. I'm as vulnerable and fragile as all of us, right? But I am so excited about the learning aspect of how to, you know navigate these territories, and how much is it that you can learn from the wisdom of others when they're going through that process. And I have no idea. I mean, this is what I want to say. In all honesty, I have no idea how I'm going to show up to my own death. Isn't that interesting, right? Because with all this preparation, you feel like, oh, I got all the tools, I got all the, tricks, I know all these things, and wow, I may be completely, you know, I mean, I may have a totally different reaction. I have no idea, but it doesn't matter really. What matters is that I feel like I am doing something to, to give me a better understanding. That's all I'm asking for. You know what I'm saying? The wisdom. I want to be able to sit in that for as long as possible, instead of reacting, to the natural process of that. So I don't know, I think we should have this conversation again sometime.
oh yeah, absolutely.
When I
There's
get closer to my death. I have no
no,
idea,
not
maybe
that
when
far
I'm
away, but
maybe, yeah,
I
I
think
was saying maybe when I'm on my deathbed, we can revisit this and see how I feel about that then.
but I think
Right.
there are so many things that we could go deeper, right? I mean, I think the conversation that I had with you right now is already triggering me so many questions in my mind, and I'm assuming that we could spend a lot of time just going deep into each aspect of it. I am also mindful of your time, and I would think this is the right time to wrap up. So thank you, Dana. I super appreciate you being on the show. I think this is a season two. I am recording the session for. This is amazing. The content was so good and so stimulating, I think, for me, and I think for the people who would be listening to this. For people who would like to reach out to you, they have questions or pointers that they need your information and support. What would be the right channel for them to reach out to you?
uh so I'm on Facebook.
Hmm.
Is it okay if I share my name, or
Yeah, I
how?
mean, if you're okay with it, if you're okay, I can also share the link to that on
Yes,
the show
yes.
notes.
So I think Facebook would be, for now, the safest way. And I think if somebody wants to have any, you know, reach out to me for anything that is related to the podcast or follow-up questions and so on, they could send me a message there, and I'm happy to respond to them either by email or, through Messenger and
Yeah.
whatnot. And I'm also on LinkedIn, as you know. I think we
Hmm.
are connected on LinkedIn.
Yeah.
And I'm not an Insta scam fan. So I am not on Instagram. But Yeah, I mean, and we also are on the platform that we met on.
Yeah.
You can't really find people there selectively, like you cannot choose to connect with a certain person.
Yeah.
But I'm so grateful, Vivek. I wanted to end with that. I'm very grateful that you gave me the opportunity to speak, about my passion and the way how I have been, you know, navigating my own life so far. It's like I said, it's work in progress, and just accepting our own, you know, humanity as it is. I think it's the key to, to staying connected to a meaningful existence. You know.
Absolutely. Absolutely. Thank you so much, Dana. And I will have you again, of course. I think I'm already seeing a lot of things that we can talk about in the next iteration of this podcast.
Okay, and I hope to be still alive. Yeah. Okay. All right. Sounds good. Thank you so much.